Good morning, everyone. Welcome to Munson Healthcare's COVID-19 press conference. Today is Tuesday, January 25th, 2022. My name is Diane Mihalik. I am the Chief Marketing and Communications Officer for Munson Healthcare, and I'll be your host today. It's my pleasure to introduce today's speakers who will be joining us. You'll be hearing from Dr. Christine Nefcy, the Chief Medical Officer for Munson Healthcare. Also from Wendy Hirschenberger, the Health Officer of the Grand Traverse County Health Department. Lisa Peacock, the Health Officer of the Benzie-Leelanau District Health Department and the Health Department of Northwest Michigan. And Dr. Jennifer Morse, the Medical Director of District Health Department number 10. Before we get started, I just want to remind everyone that we will have a Q&A session after the panelists have finished their presentations. If you are a reporter joining us live or on the webinar, you can ask your question by submitting it through the Q&A session. Or if you're one of our viewers that is watching us live on Facebook, we're happy to have you with us today. Feel free to submit your questions via Facebook and we'll get to as many as we can within our 45-minute time period. So without further ado, it is my pleasure to welcome back Dr. Christine Nefcy, Chief Medical Officer for Munson Healthcare. Welcome, Dr. Nefcy.
Thanks, Diane. All right, let's go ahead and get into our numbers. You can see here on our graphic that cumulatively we have crested over the 100,000 mark for cases of COVID-19. I really do want to point your eyes, though, down to that very bottom where you can see we are continuing at the state of Michigan as well as regionally to have quite high percent positivity. That 32.1% for the state is down a bit. And you can see, again, as we look at the weekly average, that's also down, which is an indication to us that we are seeing a slow decline in our percent positivity. Next slide. That's not quite the case for us regionally. So you can see there we're at a 27.2%, which is an increase from where we have been. And then that daily average is at 28.8%. So again, an indication that we are still continuing to trend up. We are lower than the state as a whole, but certainly both regionally and statewide, very high rates of percent positivity. Next slide. And there you can see sort of where we've been. We had that long uprise surge with the Delta variant, a decline, and then you can see we are really holding steady on our inpatient cases for COVID-19 since the start of the Omicron variant. Next slide. Purple is the color of the season, I guess, but you can see there really across the country quite high rates of percent positivity. So really across the country, lots and lots of high spots, or hot spots rather. We are hearing that there are areas that are starting to trend down, which is good news, although I'd say the sheer number alone is still quite high. Next slide. And here you can see our graphic. So we really have been holding steady in our numbers in probably the 80s here for a couple of weeks. We currently have 88 patients hospitalized. 31 of those are vaccinated, 5 boosted, and then 57 unvaccinated. So still seeing the largest percentage of our inpatients are unvaccinated. And then in our ICUs, the same picture, 30 patients in our ICUs with COVID-19, 6 of those are vaccinated, 24 unvaccinated, and then you can see there our number of ventilated patients. So still seeing the vast majority of patients hospitalized for COVID are not vaccinated. Next slide. And then this is just us tracking influenza. So you can see there low numbers, but we are starting to see a more steady trend with influenza. So this is just something we continue to follow, and right now holding steady on those numbers, but still well within the flu season. Next slide. And then, we do field a lot of questions about Omicron variant, and you can see there that really exponential rise that we have seen with this one, which really is just an indication of how contagious this variant is. The good news is with that sheer number, that the numbers of patients we're seeing with severe illness and the mortality rate is indeed lower than what we've seen with previous variants. That being said, the exponentially high number of cases that we're seeing is still just by the denominator alone causing higher hospitalizations. But we are starting to see that we've at least leveled off, if not starting to trend down in some cases across the state and nationally. Next slide. And again, we still have, we do now have options to treat COVID-19, but they are limited. And we'll talk about that a little bit with the monoclonal antibody. But just as a reminder that vaccination is still your best option to avoid hospitalization and serious illness. We have seen a change in the monoclonal antibody treatment that's available. So with this particular variant, the current or the past monoclonal antibody that we were using is no longer under an emergency use authorization. So the newest one that we have, we are using, but it is actually in quite short supply. So as an example, we only got 24 patient treatment doses for last week. And combined with all of our other ones, as an example, we had 147 referrals and were able to give 64 doses last week. And that is purely secondary to the supply. So we really are using the criteria from the CDC and the Michigan Department of Health and Human Services. Only those most at risk for getting seriously ill from COVID-19 are being triaged to receive this treatment. And as I was saying, we have very limited numbers. So I just want to stress for everybody, because we do sometimes hear, oh, I'm not going to get vaccinated, I'll just get the monoclonal antibody. It is in very short supply, and there is absolutely no guarantee that we will be able to provide that for you if you contract COVID. Next slide. And hopefully everybody is aware that there are now you can order from the federal government for free at-home COVID-19 tests. I know I ordered mine for my family last week, and they were supposed to come out or get put into the mail this week. So I am waiting to see when they arrive. But if you are interested in getting tests for your family, you get 4 tests per family at each address, and it's very, very easy. You just get online, enter in your information, and they tell you they're going to send them to you. So fingers crossed that works.
Thanks, Dr. Nefcy. Appreciate the update. Sounds like we're holding steady still with the hospitalization numbers. So still, we'll continue to do these weekly updates as we continue to just kind of hold steady, I guess. Right. So thanks, Dr. Nefcy. We'll have you back in a little bit for the Q&A session. Next, I'd like to introduce Wendy Hirschenberger, who is the health officer with the Grand Traverse County Health Department. I believe that we are having some technical difficulties with Wendy's camera today, so we may just hear Wendy's voice. Wendy, are you there?
Yes, I'm here. So for now, you'll have my voice, but once I'm done speaking, I'll try to see if I can't get the camera working until before the Q&A. But for now, we do have some slides to go through. Can you go to the previous slide, please? Okay, interesting. So it skipped a slide, but I can just talk. So I would say right now our case numbers and trends were at our highest level ever as far as community transmission and as far as case rates. The numbers have been doubling every 2 weeks since the beginning of January. So we're kind of quadrupled where we were at the end of December right now. So what that means as far as numbers is we've had 1,042 newly identified cases and 1 death within the last 7 days. We're averaging about 150 cases per day right now. We have had a few days where we've averaged above 160, but right now it's 150. And since the beginning of the year, we've had over 3,000 cases just in Grand Traverse County. And then also our percent positivity is our highest yet throughout the pandemic at 28.7. It appears to be still climbing. And as I said, the deaths have slightly decreased. So when we look at the slide that's on your screen, that's just demonstrating the weekly cases per 100,000. So that's the rate. We're at 1,294.5. That's like the highest number I've seen for our county. And I included just some perspective, a 3-month perspective, just so you could see when we thought things were, you know, high and bad in the fall, just how far we've climbed since then. Next slide, please. Okay, so we started curbside COVID testing last week it's near the airport. It's on Airport Access Road, and it's in a partnership with the Michigan National Guard. There's a link that you can see there, or if you go to our website, you also can see when you go to COVID testing a link for appointments. Currently, it's Monday through Friday. I would encourage people to check the scheduling link every day for openings, even multiple times a day. The way the scheduling tool works is that it opens appointments 24 hours in advance. It's meant to be for diagnosing, not necessarily just to screen or to get a negative. And so that's why the appointments are set up that way, so that when you have symptoms and you need to get tested, there should be openings. All ages are welcome. You remain in your car, you bring a form of ID, and then you get your test results right there. And that is rapid antigen testing. Next slide, please. Also, we're continuing our vaccination clinics. We will be shifting a bit in the following weeks, but for this week, we're still doing the ages 5 to 11 at our main health department. We do have appointments that'll be released every Wednesday at 10 a.m. And that's for this week. I have to stress that. And then we do the 12 and over at Cherryland Mall this week as well. Those appointments are probably mostly booked, but there still might be some openings for this week. So then starting next week, if you go to the next slide, we do have some changes. We will be combining the 2 clinics into one. So all vaccination clinics starting next week for the health department for COVID will be at the Cherryland Mall Clinic site. No appointments will be necessary anymore. It'll be walk-in only. And it is all ages 5 and above. Just to note that the 5 to 17-year-olds need to be accompanied by an adult. And you can get any of the options, whether it's first dose, second dose, boosters, any of those options at the Cherryland Mall Clinic. Next slide, please. And then just as many other throughout the state have done, we just pushed out some messaging on Friday about the shifting and contact tracing and case investigations. You know, really due to the significant increase in numbers and the shifting from CDC to a shortened at-home portion of the 10-day quarantine. So you have to be at home at least for the first 5 days, and then after that you're out wearing a mask. That we've shifted so that more of the responsibility is now on the individuals who are sick. So we do have information. This is something that's been statewide, and so that anybody who tests positive, we ask that they notify all their potential close contacts just to help mitigate the spread. Oftentimes, especially with Omicron, with how quickly the incubation period is and how quickly it transmits, we would be behind the 8 ball as far as even notifying people. They'd be out of that 5-day window. So this is a really important responsibility for individuals. If you go to the next slide, on our website, we do have some tools. Most health departments have the exact same information out there. It's kind of just knowing your role in preventing the spread of Omicron. I just did a quick snapshot just to show you what it looks like on our website. But if you go to the next slide, you'll actually see, if you click on any of those links, it pulls up documents that tells you what to do if you test positive, step by step, what to do if you're exposed to someone. And then there's another document that helps to understand how to count quarantine and isolation days. That's one of the things our nurses and staff frequently get asked. So it really kind of spells it out for you step by step in that chart. That's all I have for today. Thank you.
Thank you, Wendy. That's really great information. And I do encourage all of our viewers to check out that the quarantine information that you've posted. I did find that very helpful when trying to answer some questions myself. So thanks, Wendy. Thanks again for everything your team is doing in Grand Traverse County. We will have Wendy back for the Q&A session after the panelist presentations are finished. But next, I'd like to welcome back Lisa Peacock, who is the health officer for the Benzie-Leelanau District Health Department and the Health Department of Northwest Michigan. Welcome, Lisa.
Hi, Diane. Thanks so much for having me today. So I wanted to touch on just some information that we've received from MDHHS, and that, just reflects the planning that they have been doing about moving forward in 2022 around our response to the pandemic. Certainly, we've learned a lot about COVID-19 in the last couple of years and have watched it evolve in several different ways. And so this was helpful for me to understand the priorities that they're setting. And so I thought I would share that today. So really the overarching goal in the pandemic response is to prioritize equity and to follow these three guiding principles and these objectives. So number one being, our goal is to prevent death and severe outcomes. And that involves making sure that everyone who needs to be vaccinated and get a booster dose is able to do that, especially focusing on protecting the most vulnerable in our state by mitigating risks in congregate settings. This means like long-term care facilities, group homes, shelters, jails, schools even fall into that category in a certain way. And then maximizing early access to testing and therapeutics so that people know if they're positive for COVID, they know if they are able to qualify for treatment, and if so, where to get it. Hopefully the supply on those therapeutics will improve over time and more people will be able to seek that early treatment to prevent severe disease. The second objective that they're focusing on is protecting the healthcare capacity. And that means everything from emergency medical services to the hospital systems. One thing that's of great concern to our state is that our hospital systems have been strained for a long period of time. So as we're facing this Omicron surge, which is happening right now, this large surge in cases, our hospital systems and our EMS systems were already strained. And so we're starting from, a difficult place, and it requires everyone to do what they can to reduce community spread. Also under this goal is making sure that we can reduce the severity of cases. So people who are at risk definitely should be vaccinated, definitely should make sure they get their booster, and making sure that all of our providers understand the use and the availability of therapeutics for people who are really at risk and need them during this time. And then the third guiding principle is keeping our vital infrastructure functioning. And so certainly it's an important goal right now to keep life as normal as possible, making sure that we don't have interruptions in school being able to function, that our correction system can function, local government, businesses, the economy continue to function while we plan for, eventually how we learn how to live with this virus. And this really involves looking at a new normal and understanding the concept of a risk budget. We won't be able to stop cases of COVID-19 from happening. We're well past that. But what level of risk is acceptable, and how can we make sure that we can stick with these three guiding principles while we have some cases going up? And part of that, a really important part of this objective, is making sure that the public has the tools that they need to protect themselves. Like Wendy just touched on in her presentation, the sheer number of cases literally make it impossible for everyone to be reached. And there's just waning public participation in that process. And so if every single person who tests positive is not going to be talking to a case investigator from the health department, then how can we make sure that the public have the tools that they need to understand how they can get tested when they might be at risk for COVID, and then the instructions for what to do if they do test positive, and in terms of isolation and contact tracing. You can go to the next slide. So Benzie-Leelanau and the Health Department of Northwest Michigan are experiencing very similar changes that Wendy described. I won't go through all of those again. The story does continue to be exponential rises in cases. We're seeing an average of over 250 cases per day. Our testing demand did go down a little bit last week. That may be as people are getting more access to home testing and other means of testing. They aren't visiting the testing sites as much. Or it may be that we had some severe weather last week. It was just a week. So we'll just kind of see what happens. We still have testing available in all of our counties and are trying to make that readily available for the people who need it. We are making some changes to home test reporting to the health department. It is no longer necessary for our health departments for people to report their positive home test, but they may report it if they would like a contact from the health department. And we are happy to contact people who have questions and need to work through what to do about their contacts and isolation and quarantine and such. As Wendy pointed out, the public health resources really are shifting away from, just really staff and resource intensive individual case investigation and contact tracing, and narrowing our focus a little bit more to support those most vulnerable and those most at risk for outbreak. So those congregate settings, trying really hard to support our schools in the ways that they need to protect their staff and student population and continue to maintain operations and in-person learning. Employers are a huge focus of our efforts too. We certainly want to hear from employers who need help, who are, having trouble understanding what to do if they have a positive staff or potentially an outbreak in their setting. Those are absolutely entities that should contact the health department, and we are happy to help you. We are expanding resources and always trying to change it up so that we make sure we're available to the people who need us and our information easily accessed. So using our media channels, thank you so much for including us in this press conference. It's really helpful. Using social media, and we're making some transitions to our dedicated information lines. And so we really want to make those public health professionals who may not be doing individual cold calls to every positive case available to those who would like to reach out to us. And so for the health department in Northwest Michigan, we included the 1-800 phone number that people can call. And then for Benzie-Leelanau this week, we included our hotline email. Both of those have been in place for a long time. Benzie-Leelanau will be expanding to a phone number as well. So hopefully the next time I'm on, I can share that. And I think that's all I had today.
Thank you, Lisa. We really appreciate all the updates and the great work your team is continuing to do. And thank you for the overview of the guiding principles from the MDHHS. It's interesting to see how things are evolving and continue to shift, and we continue to change and adapt as we go. So we'll have you back shortly for the Q&A session. And our last speaker that I'd like to introduce today is Dr. Jennifer Morse, the Medical Director of District Health Department number 10. It's always great to see you, Dr. Morse, and welcome back.
Thanks. Well, just like everyone else, our case counts have been increasing as well. Our total case counts over our 10 counties have increased just over 40%. And our case rate per our population has increased as well. Our average percent positivity has increased right around 26%, and it kind of varies between the 10 counties from 21% to over 30%. So we continue to have our community-based testing centers. We have them now in 7 counties, and we're looking at putting one in Manistee County. So we'll have them in 8 of our 10 counties. 6 are listed here. We also have the one in Grayling County, Crawford County at Grayling, at Kirtland College. You can go to our event website, and also a reminder, if you go to the my.gov/coronavirus website and scroll down just a little bit, you'll see a spot that says community testing events. Find a site, just click on there, and all of these community locations that everyone else has been talking about will all be listed on there with dates and links you can click on, so you can pre-register. Unless they're individually run by the health department, then that might be a little different, but anyone run by the state will have all that information right there. So the positivity at these community sites have been running between about 22 to 28% positive. So again, just know that those are available and free of charge, and typically provide confirmatory PCR testing when needed. Next slide. So this map just shows our vaccination rates per zip code. The colors there show the population 16 and older that have had at least one dose. Things that are pink are under 50% with one dose. Those that are green and darker green are 50% and higher for the darker it gets. Things are 0.5% higher for both initiation of vaccination series and for completion. So we are gradually seeing a bit more vaccination. Those areas that are pink have really persisted being pink, so under 50% initiation for many, many weeks now. So we do just have areas that continue to have pretty low initiation rates. But again, we are continuing to see people getting vaccinated, which is good. So our 5 to 11-year-olds, about 15% have initiated vaccinations. Those clinics are still held in our offices. You can schedule online. You can report home testing if you wish to at our website. And again, you can go to dhed10.org/events to find any of our pop-up clinics, whether it's vaccination or testing, and our other information is as listed there on the slide. I think that's all.
Thanks, Dr. Morse. Thank you again for all the work your teams are doing as well to expand testing resources and great information. Now I'd like to invite all of our panelists to rejoin us for the Q&A session that will get started. As a reminder, if you are a reporter joining us on the webinar, please submit your question via the Q&A feature. And if you're joining us live on Facebook, we're happy to have your questions as well. And Wendy may not have gotten her camera operating just yet, but we'll still remember she's there and we can ask her some questions as we go. So the first question, I'm going to start with Dr. Nefcy. The question is, can you explain the process used at the hospital to determine if a patient is hospitalized with COVID? Does COVID have to be the main factor in the hospitalization, or can a patient be hospitalized for something like a broken leg, then listed as a COVID patient if they're found to test positive for the virus?
Yeah, it's a good question. And I would say it somewhat depends. So we screen anybody who is going to be admitted to the hospital for COVID. And anybody that is positive for COVID has to be in isolation. So the numbers that we report out to the state are all of those patients who are hospitalized and in isolation. There are a number of patients that might be hospitalized that we wouldn't count. So anybody that's under observation or is in our behavioral health unit, that kind of thing, those numbers would not be counted. Same thing with our procedures. If you are coming in for an emergent surgery, say, a same-day surgery that was deemed as necessary despite positivity, you would not be counted in our numbers. Now, that being said, there are a handful of patients that would be admitted and might have be completely asymptomatic but positive for COVID. And we do track those. It's a small number. So as an example, overnight, we had, I think, 18 new COVID positive patients hospitalized across the Munson Healthcare system. 3 of them were asymptomatic and 1 of them was not COVID related. So that gives you sort of an estimate of the number. There are a very few. I know that in some media reports we've seen people report as high as 40 to 50% of patients. That is absolutely not true in our circumstance. We do look at that, but that's where we are as an example for today.
Thanks, Dr. Nefcy. Related to the hospitalization numbers, the next question is, do you see a difference in length of hospitalization between vaccinated and unvaccinated patients, and is Omicron impacting the length of stay?
So it depends compared to what. So we do, again, it's preliminary. So we are just now, since Christmas really starting to see that. So we only have probably a month of data. I would say preliminarily, it does look like there is a slightly reduced length of stay with patients with the Omicron variant versus Delta. But again, those are small numbers and more anecdotal than anything. We do anticipate, so I would just say a COVID patient in general takes a lot of care. Many of them are on high flow oxygen, they're in isolation, that kind of thing. So compared to, you know, a normal winter where we would have, you know, a hodgepodge of different upper respiratory things, the length of stay for a COVID positive patient does tend to be much longer. And certainly those that are unvaccinated tend to have a much more significant course. They have, generally speaking, a more serious illness than those hospitalized who are vaccinated. I think that answered the two questions that were in there.
Yes, thanks, Dr. Nefcy. Appreciate that. Next question is from one of our reporters, and I'm going to ask the health departments to comment on this. The question is, how many deaths have we experienced from COVID-19 recently, and are we trending up or down, and why? I'm going to ask Wendy to comment on that first, please.
Sure. I've tried to troubleshoot my camera in every way I can. We're just going to stay dark.
We'll get you next time, Wendy.
I did without just leaving the whole press conference. So I would say in the last 2 to 3 weeks, the number of deaths for, at least for our county that are reported to us, have been declining. December was really a month with a lot of deaths. So the next, I guess we'll have to see what happens in the next 2 to 4 weeks, because I think typically we've talked about that deaths from COVID tend to be a lagging indicator that we might see in 2 to 8 weeks post-infection. I'm not sure with Omicron if that's the same. That was kind of the numbers and what we were looking at with Delta. So, you know, we'll have to observe and see. You know, for me right now, it's promising to see a drop in deaths for sure. We're still seeing an occasional, you know, home deaths where somebody dies at home, didn't go see care, and we don't like to see that as well. And, you know, any death that's vaccine preventable is, you know, sad and frustrating for all of us in public health. So that's what we're seeing in Grand Traverse County.
Thanks, Wendy. Lisa, can you comment on your jurisdictions?
Yeah, I would say very much the same. Certainly in December, we saw a significant number of deaths, and just in the last couple of weeks, we've gone from hearing about a death a day in our Northwest jurisdiction, about half of that in Benzie-Leelanau, to almost a 40% decrease over the past week. So again, we will have to watch and see. I am concerned because both hospitalizations and deaths tend to be a lagging indicator, and we're just right now in the middle of this really rapid surge upward of cases. And so certainly a time to be very cautious and waiting to see what happens and being prepared for it.
Thanks, Lisa. Dr. Morse, any final comments on that?
I just echo exactly what they say. I don't have anything else to add.
Okay, great. Thank you. Next question. I'm going to have Dr. Nefcy tackle this one first. Questions from a reporter. If the number of cases and percent positivity is up, why are hospitalization numbers holding steady?
Well, we think that's because this is a less serious illness than what we saw with the Delta variant. And at the same time, we're seeing an uptick in the number of people who are getting vaccinated. And I hope that, people are assuming their personal responsibility and taking care. And if they have symptoms, they're staying away from other people. Certainly at Munson Healthcare, we re-implemented working from home so that we would decrease potential exposures. We've increased masking. So I think there are a lot of different things that probably play into that, but I'd say all of those together are probably the reason for the decrease or holding steady on hospitalizations rather.
Thanks, Dr. Nefcy. The next question, I'm going to ask the health departments to comment on first. And Wendy, I'll let you go first. The question is, are you seeing many reinfections? Is there a sense whether previous reinfection of COVID or vaccination offers better protection against Omicron?
Well, I will do my best with this question, but I am not a case investigator, so I don't necessarily know. I know I've heard we've had some reinfections. I don't know if we're seeing it at a higher rate with the Omicron variant compared to the Delta variant. So I probably should stop at that point and see if Lisa or Dr. Morse has anything to add that might add some clarity.
Lisa, do you have any thoughts on this? I don't know if we know the answer to this one.
Yeah, sure. I mean, I can take a stab at it. You know, I don't have the data in front of me. Anecdotally, I can say that we've certainly seen more people testing positive for COVID that had COVID last year or, you know, sometime in the past than we've seen before. Not seeing a lot of reinfection within the 90-day window. That typically has, you know, all the data is pointing to that, you know, kind of natural immunity that lasts for about 90 days. And the evidence is also pointing toward really good protection between natural immunity and, you know, the vaccine mediated immunity when people are fully boosted. And so, you know, the very best thing you can do to protect yourself is get that booster and make sure that your status is completely up to date. But other than that, you know, I'm not sure. I think it's going to take some more time for us to really fully understand what that looks like. Not sure that it's due to any certain type of variant or just waning immunity over time. And maybe Dr. Morse has more to share.
Yes, we do see reinfection. It's hard to really measure accurately, especially since Michigan's not actively tracking that. Some other states are tracking that information. But it is a difficult one to know for sure because of the issues with some testing remaining positive and really differentiating out symptoms. You know, is it a new illness? Is it something different? But we do have cases where people do have a discrete new illness and do have a new positive test. But again, it is a complicated thing. And of course, we all know that there are people that are not very symptomatic and are infected too that aren't being tested. So
Thank you all. I know that was a tough question to answer. We'll continue to monitor that. And if any new data becomes available to us, we'll make sure to include that at a future press conference. The next question is again for our health department partners. I'll start with Wendy. Have there been any reports of severe reactions to the booster shot that people should know of?
Well, I can speak just from the clinics where we administer vaccines, and no, we have not experienced any severe reactions whatsoever, even with, you know, the children. So we have not experienced that.
That's good to hear. Lisa, anything different?
No, I really would say the same. I would say the same.
Great. Dr. Morse, are you aware of anything?
no, not with the boosters. Usually they're extremely well tolerated, better than any of the other doses.
Great, thank you very much. Dr. Nefcy, is the area starting to see an increase in pediatric hospitalizations due to the sheer number of new cases?
Yeah, you know, again, we track this at the state level since our children's hospitals are all south of us. And those pediatric hospitalizations have been holding steady over the last couple of weeks between about 115 to 130. So kind of that fluctuation. And I think that's in part because we do certainly see some children with active COVID, similar to what you would see in an adult. And then we also in the pediatric population have the MIS-C, which is that post-inflammatory illness that is about 2 weeks or more after having the initial COVID infection. So we would expect those pediatric hospitalizations to stay up relative to the adult ones as they start to come down. And that is in fact what we're seeing.
Great, thank you, Dr. Nefcy. One more question to you related to hospitalizations. The question is, it appears that as Omicron takes the lead, the ratio of vaccinated to unvaccinated hospitalizations is rising. Is that an accurate observation, and is there a known reason?
So I think what you're asking is, are we seeing is about breakthrough cases in our hospitalized? So we're seeing a higher number of hospitalized patients who have been vaccinated, I think is what the question is getting at.
I think so.
Okay, we are. I think what we're learning is that really the 2 doses is not sufficient against Omicron, and that really if you want to be fully protected or as much as you can be, you need to get your booster shot. So again, it's around 5% or less, depending on the day, of boosted people who are hospitalized. And yes, as we start to see our case percentages go up across our community, we are seeing a higher number of breakthrough cases. That just kind of follows the math. But we are still very much protected against serious illness with vaccine in general, but certainly being boosted is highly recommended as being the most protected you can be.
Thanks, Dr. Nefcy. The next question, I think it relates to your slide that you had on monoclonal antibody therapy. You mentioned that the demand is higher than the current supply. What other treatments are available to patients today?
Well, we did recently get the oral antivirals that were put forth from the state, again, limited in what we are seeing, but those are available. And that is one option in addition to the monoclonal antibody for treatment of COVID rather than prevention.
So if somebody does have COVID-19, and you mentioned this oral medication that's now available, would they need a referral from their primary care physician or their healthcare provider in order to get that? And how are we doing on supply with that?
So yes, it's just like any other medication. You need a prescription from a licensed provider in order to get that medication prescribed to you. But again, just like with many of our other things, there is a significant supply issue with both of those orals. And so, again, there are clear criteria. I will say too, there's significant side effect profiles and drug interactions with those. So it's not going to be something that's available for everyone. And again, part of the reason why you go to your doctor to have those conversations about whether those drugs are right for you. But yes, limited supply, and you need a prescription.
Thanks, Dr. Nefcy. I just want you to take another moment to reiterate the status of monoclonal antibody therapy treatment in our region right now. I am seeing a lot of people posting on social media that they are choosing not to get vaccinated because we have these other treatments available. So if they do get Omicron or COVID-19, that they can just get one of those therapies and they'll be okay. Can you comment on that some more, please?
Yeah, again, very limited. So we have changed what was available. The BAM-EVI that we were using before is no longer under emergency use authorization. So that is no longer being given. So the one monoclonal antibody that we have right now is in limited supply. And as an example of that limited supply, Munson Healthcare last week got 24 doses. So we are extremely limited in who is able to receive those treatments. And the MDHHS has offered tier 1, A and B, as well as tier 2, as far as differentiating who is prioritized to receive that. And right now, we are only able to give it to those that are in the very highest level of that tier for risk, just because of the supply that we have. So it is significantly limited. I would absolutely never recommend to anybody that they could count on that as treatment for COVID-19 if they happen to get it.
Thank you, Dr. Nefcy. Wanted to make sure that we really stressed that today because we were seeing a lot of conversation on social media about it. And I know that we've also had some patients show up at Munson Healthcare requesting monoclonal antibody therapy, and we just were not able to provide that. So please take that into consideration as you make personal health decisions with your doctor, especially about getting vaccinated. Unfortunately, we are out of time today. I would like to thank our speakers, Dr. Nefcy, Wendy, Lisa Peacock and Dr. Morse. It's always great to have you join us and give the full picture of everything happening in our region. I just have a few final closing slides here. So I always like to put up the slide on community resources. It gives a nice summary of all the health department contact information. And as a reminder, vaccines.gov is a great resource. 211 Michigan is a great resource, and also the Area Agency on Aging of Northwest Michigan is also a wonderful resource in our area. Next slide, please. Also available on Munson Healthcare website and at many of our health department websites is our testing resources. Please take note that Dr. Nefcy mentioned you can go onto that government website and get 4 home kit tests delivered directly to your home, but also check out our local health departments, your primary care provider, local retail pharmacies, and you can also go to michigan.gov/coronavirus or the Michigan COVID-19 hotline. As always, if you have questions about testing, whether or not you should be tested, the Munson Healthcare Ask a Nurse hotline is also available for you on a daily basis. That number is 231-935-0951. Next slide, please. And that Ask a Nurse line is also available to answer general health questions that you have. It doesn't have to be COVID-19 related, but if you're still unsure about getting vaccinated and whether that's right for you, or if you're eligible for a booster, feel free to call that number. And those nurses are extremely knowledgeable and very helpful. I also invite you to join us on social media, follow us on Facebook, LinkedIn, Instagram, Twitter, and YouTube. Sign up for our bi-weekly e-newsletter where we have a lot of really great COVID information in there, as well as other updates on Munson Healthcare, what's happening in our system and general health information. I also encourage you to visit us at munsonhealthcare.org for the latest information. So again, thank you for joining us today, whether you were our reporters asking some really great questions or joining us live on Facebook. We're always happy to do these. We will see you again next week. Have a great day.